Hi guys, it's always a privilege to speak to you. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with a special interest in ultrasound. And today I'll just plan to speak to you about the role of ultrasound in breast cancer screening. Just want us to at least to remind ourselves why we do ultrasound scans during this period when we are screening for breast cancer. One of the reasons why we do the ultrasound is just to make sure that your breast tissue is normal, and there's no lesion, there's no mass that is in your breast. We'll also do the scan up to the axilla to make sure there's no mass, there's no lesions, there's no lymph nodes which are swollen in the axillary region. If there are any masses that we can see in the breast, one thing that we like to do is to grade. Grading means we like to look at it and classify it. That means are we able to say that this mass looks more cancerous or is just benign? We would like to know, is this mass does it lean towards more malignant, or is it's just maybe a fatty tissue that's just swollen, or is just a benign lesion? Benign lesion means the lesions which might not be cancerous. So we like to grade it. We like to grade it from grade 1, grade 2, grade 3, grade 4, grade 5. The higher the grade, the more chances are that the lesion is going to be cancerous. And if we have a higher grade, then we'll be able to advise the patient. We'll be able to advise the mother to go for further procedures like biopsy or ultrasound guided fine needle aspiration, so that tissue can be taken from the mass, taken to the laboratory, so that we can check if true the lesion or the mass is malignant. So during this time, especially the month of October, when there's breast screening, when there's breast cancer screening, as ladies who are beyond 35, 40 years, kindly be encouraged. Go have a breast scan. It's a painless procedure. It's a very simple procedure. Go have a breast scan done, so that at least we can look at your breast. If there's anything that we can pick, then we can go ahead and do further test, get further information from whatever has been picked, so that if it is malignant, then the treatment can be done, can be started as early as possible. And one thing you need to note is that if we pick cancer, if it's in early stages, it's more easier to treat it. The prognosis or the outcome of the treatment process becomes more positive, and actually is even cheaper. So if we can pick the lesions, cancerous lesions, which are still early, then the treatment might be even cheaper to you. The cost effectiveness of it's more beneficial than when we pick the lesion when it's at the later stage. So take advantage. If go visit your healthcare providers. Take advantage of this season. Have your breast screening done. Have a breast scan done, breast ultrasound done, so that at least we can just make sure that everything is okay. And as I've always said, our prayer is that you are going to be fine, that God is going to keep you, that you're going to be well. Even if we find that there's something, we'll be able to handle it. Even if we find that there's something which is maybe malignant or cancerous, our prayer is that at the end of the day, we'll have a very positive very positive outcome, so that at least we can always keep on improving the quality of life of each one of us. Thank you.